The Senate plan to repeal and replace Obamacare may be in trouble after a group of conservative senators say the plan didn't go far enough in being fiscally conservative, like Kentucky Senator Rand Paul and three other GOP senators who say the newly released health care plan is dead on arrival unless they see major changes. The four sticking together to get changes like fewer government subsidies, the ones designed to make health insurance more affordable.
We estimate the cost of the subsidies to buy insurance. We actually believe that they may exceed or at least equal the subsidies that are in Obamacare.
The problem facing Republican leadership is that any changes that move the bill further to the right have the potential to alienate more moderate Republicans.
We have to protect Medicaid expansion states. That's what I want. Make sure that we're taken care of here in the state of Nevada.
That is Republican Nevada Senator Dean Heller announcing today he cannot support the plan because it rolls back Obamacare's expansion of Medicaid. It puts federal funding limits on the program. Victims of domestic violence are among those who a local group says could be devastated by the Senate health care bill. Safe Harbor advocates for survivors, and they're speaking out against this legislation. An Upstate Republican leader says it's much too soon to make those claims. 7 News reporter Nikel Smith has the details. Nikel.
Well, Gordon, we're talking about how some South Carolinians in particular could be affected by cuts to Medicaid. That's where domestic violence advocates say victims are especially vulnerable.
When a woman leaves a domestic violence home, many times she has absolutely no resources.
Resources they can get help finding through organizations like Safe Harbor. South Carolina constantly ranks among the worst states for domestic violence.
Those numbers are attached to individual people that we see on a regular basis that are having a hard enough time trying to figure out how to, pay rent and put food on their table. The fact that they will, at this point, not be able to have basic health care, to me, is an abomination.
The Senate health care plan cuts back federal funding for Medicaid.
The folks who are uninsured are going to increase dramatically.
Safe Harbor Executive Director Becky Callahan says for domestic violence victims who are starting over, health care is crucial.
Many of the victims of domestic violence have stayed home and taken care of their children, and now are moving toward trying to provide for their children, and they aren't making the money in order to afford health care.
Spartanburg County Republican Party Chairman Josh Kimbrell says it's too early to tell how the bill will affect everyone.
We keep hearing all this prognostication of doom, and we haven't even passed a bill yet. So let's see what's going to happen here. The conference committee hasn't happened, and if you look at the bill, it's going to expand access to care.
Kimbrell also says he feels there are good and bad parts of the Senate health care bill. Gordon.
All right, Nikel, thank you. Majority Leader McConnell insists he wants a vote before the 4th of July recess when the senators go back home to their districts. That leaves Republican leaders just a few days to win over these votes.